So we have to exclude the introduction. You know sepsis. Sepsis is the killer number one, at least of my patients, worse, but not more. So sepsis, this sepsis is a common, and the mortality rate and the incidence is more than all these type of cancer. This is how deadly is sepsis. That the severe sepsis is more than acute myocardial infarction, lung cancer, colon, breast cancers. High density of lipoprotein. It is a new biomarker. This is the aim of our study, is to evaluate the relationship between sepsis and lipid profile, and to create a new biomarker for sepsis, more easy, practical, and sensitive, and to increase the abuse of antibiotics. It is not working. Where's the technician? Okay. Method and material. 75 patients were enrolled in this study at Asada Teaching Hospital in Maysan, Iraq, from April through September 2013. Blood samples are collected for biochemical tests every 2 days. Blood count test every 2 days, and blood cultures every 3 days. Some patients are excluded from this study due to different reasons. For example, patients that died or referred to another center during the first 48 hours, or patients with history of atherosclerosis or on medication, the anti-hyperlipidemic medication. Age, this is the criteria of my patients, and this is the lipid profile for all 75 patients at the onset of burn injury with normal range of lipid profile. It seemed to be normal. This chart shows that the lipid profile on the onset of burn is within the normal range for all patients, every patient, without relation with what is total burn surface area, or the age of the patient, or any other parameter. While the lipid profile at the onset of sepsis, it's completely different. You can look at this chart. This is the high density lipoprotein, the red one. It's about 0. I'm astonished that the scientists all over the world don't discover this part, that the patient with sepsis is without HDR, that the concentration of high density lipoprotein is 0. All patients with hypertriglyceridemia. Triglyceride is higher all patients. Why this fact? Because that the core of high-density lipoprotein, about 70 to 80% of the core of the high-density lipoprotein particles consists of triglyceride. So the destruction of triglyceride, of high-density lipoprotein, leads to the high level of triglyceride. This is the comparison between the lipid profile at the burn side onset and sepsis onset. We can see that cholesterol, there is no big difference. While in triglyceride, there is a significant difference, and there is a big difference. And about HDL, our biomarker. So, there is many levels for HDL. HDL value between 30, the normal value of HDL between 40 and 60 milligram per deciliter. So if patient with 30 to 40 milligram per deciliter, it means that there is no clinical evidence of infection in our study. There is no need for antibiotic. From 15 to 29 milligram, there is clinical evidence of infection. And blood pressure, while negative. Why this happened? Because we know that the systemic inflammatory response syndrome, which is accompanied with the sepsis, it is not always the source of infection. It may be because of as a response for burn. It is an inflammatory response. So our result is when HDL value less than 15, the blood culture was positive, but there is no clinical evidence. Maybe there is fever, maybe there is high or low white PC count, but there is no tachycardia, there is no tachypnea, there is no change in the skin of the patient. But when it reaches to less than 5, I want to say that less than 5 is the lowest value that can be measured by our system in the laboratory. So when HDL, it means that less than 5 may be from 4 to 0. This septic shock. And if HDL value continues to be less than 5 for more than a week, patient is definitely dying. Conclusion. There is a close relationship between sepsis and high-density lipoprotein reliever. High-density lipoprotein can be considered as a natural antibiotic because the little time allowed to me, I cannot explain the mechanism by how HDL, high-density lipoprotein, can act as a natural antibiotic. A lipid profile are very sensitive to bacterial infection, especially sepsis. HDL level can be used to predict the exact time of initiation and stopping antibiotic. Recommendation, HDL should be used as a biomarker for sepsis. At last, I want to say that from the discovery of this biomarker, no one patient died with sepsis in my unit. Thank you.